The topic of discussion for today's module is the anatomy of the stomach as well as its clinical importance. So here, the stomach is the expanded part of the digestive tract and is located between the esophagus and the duodenum. Here the stomach is specialized for the accumulation of the ingested food, which is chemically and mechanically prepares for digestion and passage into the duodenum. So the stomach acts as the food blender and reservoir, and its chief function is the enzymatic digestion of carbohydrates, proteins and fats. So the location of the stomach, it lies obliquely in the upper as well as left part of the abdomen, mainly occupying epigastric, umbilical as well as left hypochondriac regions. The size of the stomach is approximately 25 centimeters long in adults, and its mean capacity differs, that is 30 ml at birth, 1 liter at the puberty, and approximately 1.5 to 2 liters or more in adults. Now let us concentrate on external features and relations of stomach. So what are the external features? As you can see in this picture, stomach has 2 orifices, 2 parts and 2 curvatures. So what are the orifices of the stomach? It has the cardiac orifice and next is the pyloric orifice. The cardiac orifice is the superior opening or also called as the inlet of the stomach, and which is joined by the lower end of the esophagus. And this cardiac orifice mainly lies at the level of T11 vertebra behind 7th costal cartilage, and it is approximately, you can see here, 2 to 3 centimeters from its junction with the sternum. And the sphincter action at this orifice can be demonstrated only physiologically. And next one is the pyloric orifice. So it is the inferior opening or also called as outlet of the stomach, which mainly opens into the duodenum, and it lies at the level of L1 vertebra, or we can say transpyloric plane, and it is approximately 1.2 centimeters to the right of the median plane. And next is the parts of the stomach. So here the stomach is divided into 2 parts by a line drawn downwards and to the left from the cardiac end to the angular notch, and the line is extended further to the greater curvature. So the larger part is known as cardiac part and the smaller part which is known as pyloric part. So here the larger cardiac part of the stomach is subdivided into fundus and body, and the smaller pyloric part is subdivided into pyloric antrum and the pyloric canal. So here next is the fundus of the stomach. So if you see the fundus of the stomach over here, it is the dilated superior part mainly situated above the horizontal line, which is drawn at the level of the cardiac orifice and is mainly related to the left dome of the diaphragm. And the fundus may be dilated mainly by the gas, fluids, food, or any combination of all these things. So after fundus, let us talk about the body of the stomach. It is the major part of the stomach and lies between the fundus and the pyloric antrum. So here the gastric glands are distributed in the fundus as well as the body of the stomach, and mainly contains all the 3 types of secretory cells. They are mucus cells, chief cells, peptic cells which secrete the digestive enzymes, and the parietal cells which mainly secrete hydrochloric acid. And next one is the pyloric part. As I already told you that the pyloric part has been divided into pyloric antrum and the pyloric canal. The first one is the pyloric antrum. And if you see this, the pyloric antrum is approximately 7.5 centimeters long, and it has pyloric glands which are rich in secreting mucus. So that's the reason we call rich in mucus secreting cells. And it is separated from the pyloric canal by a sulcus, what you can see over here, that is called as sulcus intermedius, present on greater curvature. And next one is the pyloric canal. The pyloric canal is approximately 2.5 centimeters long. It is narrow and tubular in nature. At its right end, it terminates with the pyloric orifice. So this is what you need to know about the pyloric part of the stomach. Now let us concentrate on discussing the curvatures of the stomach. It has the lesser curvature and the greater curvature. So what is the lesser curvature of the stomach? It is the short concave right border of the stomach, and it mainly provides attachment to the lesser omentum. Here the angular incisure, that is the notch, is the most inferior part of the lesser curvature that mainly indicates the junction of the body and the pyloric part of the stomach. And the next one is the greater curvature. So when compared to that of the lesser curvature, you can see over here that the greater curvature is the longer convex left border of the stomach, and it gives attachment to the greater omentum, gastrosplenic ligament as well as gastrophrenic ligament. So here at its upper part of the greater curvature, it has a notch called as cardiac notch, which separate the greater curvature from the esophagus. So this is what you need to know about the lesser curvature as well as the greater curvatures. Next, relations of the stomach. In the relations of the stomach, first we will concentrate on the peritoneal relations. So here the stomach is lined on its both surfaces by peritoneum. So here the layers of the peritoneum lining the anterior as well as the posterior surfaces at lesser curvature meet and continuous with the lesser omentum. The two layers of the peritoneum meet along the greater part of the greater curvature to form greater omentum. And the two layers of peritoneum meet near the fundus to form gastrosplenic ligament, and the posterior surface of peritoneum near the cardiac end is reflected onto the diaphragm to form gastrophrenic ligament. These are the peritoneal relations of the stomach. After knowing peritoneal relations, let us concentrate on the visceral relations. So anteriorly, if you see, the stomach is related to the diaphragm, the left lobe of the liver, transverse colon, and anterior abdominal wall. And posteriorly, the stomach is related to the omental bursa as well as the pancreas. So the posterior surface of the stomach forms most of the anterior wall of the omental bursa. Now, what is the bed of the stomach? So bed of the stomach means on which the stomach rests in the supine position. So here the bed of the stomach is formed by the structures forming the posterior wall of the omental bursa, right? If you remove the omentum, you can see the structures which are related to the posterior wall of the omental bursa. And if you see these structures from superior to inferior, you can see left dome of the diaphragm, spleen, left kidney and its suprarenal gland, splenic artery, pancreas, transverse mesocolon. All these structures form the bed of the stomach. Now, after knowing the visceral relations and the peritoneal relations, now what are the neurovascular structures of the stomach? That is the blood supply. So if we talk about the arterial supply of the stomach, so arterial supply along the lesser curvature is by the left gastric artery, that is the branches of the celiac trunk, and also the right gastric artery, which is the branch of the proper hepatic artery. And the arterial supply along the greater curvature is by the gastroepiploic artery, which is the branch of gastroduodenal artery, and the left gastroepiploic artery, which is the branch of splenic artery. And if you see the arterial supply of the fundus of the stomach, approximately by 5 to 7 short gastric arteries, all these are the branches from the splenic artery. And next is the venous drainage. Right and left gastric veins drains into the portal vein. and left gastroepiploic vein and short gastric veins drains into splenic vein, and the right gastroepiploic vein drains into the superior mesenteric vein. This is what you need to know about the venous drainage of the stomach. Next is the lymphatic drainage of the stomach. Lymph from the upper one-third drains into the pancreatico-splenic nodes on the back of the stomach, which in turn drains into the celiac nodes. Lymph from the lower part of left one-third drains into the right gastroepiploic nodes, which mainly drains into subpyloric nodes as well as from subpyloric nodes into hepatic nodes and finally into the celiac nodes. And if we see the lymphatic drainage from the right two-third, mainly drains into the gastric nodes, which in turn drains into the celiac nodes, that is abdominal part of the esophagus, also drains into left gastric nodes. So here the lymphatic drainage from the pyloric part drains into the pyloric, hepatic and left gastric nodes, and from all these nodes they drain into celiac nodes. And lymph from all the areas of the stomach reaches the celiac nodes. From the celiac nodes it passes through the intestinal lymphatic trunk to reach cisterna chyli. So this is what you need to know about the lymphatic drainage of the stomach. And the next one is the nerve supply. So in the nerve supply, first is the sympathetic nerve supply of the stomach. Sympathetic nerve supply is mainly from T6 to T10 segments of the spinal cord, mainly via greater splanchnic nerves, and it is distributed through the celiac as well as hepatic plexus along with the gastric as well as gastro-omental arteries. And what are the functions? The functions are vasomotor, and it is a chief pathway for the pain sensations from the stomach, and also it is motor to the pyloric sphincter while inhibitory to the rest of the gastric musculature. And this is what is about the sympathetic innervation of the stomach. And next is the parasympathetic innervation. The parasympathetic nerve supply is mainly from the anterior and the posterior vagal trunks and their branches, which enter the abdomen via esophageal hiatus of the diaphragm. So the first one is the anterior vagal trunk. So anterior vagal trunk is mainly derived from the left vagus nerve, that is cranial nerve 10, and it usually enters the abdomen as a single branch that lies on the anterior surface of the esophagus. It gives off hepatic and duodenal branches which leave the stomach in the hepatoduodenal ligament. And the rest of the anterior vagal trunk continues along the lesser curvature, giving rise to anterior gastric branches. This is what is about the anterior vagal trunk. And the next one is the posterior vagal trunk. The posterior vagal trunk is derived from the right vagus nerve, and it enters the abdomen on the posterior surface of the esophagus and passes towards the lesser curvature of the stomach. It supplies the branches to the posterior surfaces of the stomach. So here it gives off a celiac branch which passes to the celiac plexus and then continues along the lesser curvature, giving rise to posterior gastric branches. And what are the functions of the parasympathetic nerves which are innervating stomach? Motor as well as secretomotor to the stomach, and it is inhibitory to the pyloric sphincter. And the stimulation of these parasympathetic nerves causes increased motility and peristalsis of the stomach, and there will be a secretion of the gastric juice which is especially rich in pepsin as well as hydrochloric acid. Now let us talk about interior of the stomach. So in the interior of the stomach, it has divided into several layers. The first layer is called as the mucosa of the stomach. So the gastric mucosa of the empty stomach, as you can see in this picture very clearly, is thrown into longitudinal folds, right? These are also called as longitudinal ridges or wrinkles, called as gastric folds or gastric rugae, and they are most marked towards the pyloric part and along the greater curvature of the stomach. On the mucosal surface, there are small numerous depressions known as gastric pits, and they are nothing but the gastric glands which open into these pits. And during swallowing, a temporary groove or furrow-like gastric canal forms between the longitudinal gastric folds along the lesser curvature due to the firm attachment of the gastric mucosa to the muscular layer. When the stomach is mostly empty, saliva as well as small quantities of masticated food and other fluids drain along the gastric canal directly to the pyloric canal. So here the gastric folds diminish and obliterate as the stomach is distended, which means fills. So after the mucosa, the next layer is called as the submucosa of the stomach. The submucosa is mainly made up of the connective tissues. It contains arterioles and nerve plexus, and the mucous layer does not. And next one is the muscle coats of the stomach. Most superficial fibers are longitudinal in nature, so they are longitudinal fibers and they are mainly along the curvatures. And next is inner circular fibers encircle the stomach, and they are thickened at the pylorus mainly to form pyloric sphincter. And the deepest layer is the oblique layer, which contain obliquely placed fibers which loop over the cardiac notch, and some of these fibers spread in the fundus as well as body of the stomach. And at last, the last layer, which is called as the serous coat of the stomach. It mainly consists of peritoneal covering. So this is what you need to know about all the layers of the stomach. And next is, what are the functions? As I already mentioned in the beginning in the introductory part, that it mainly acts as the reservoir of the food as well as the food blender, right? Because majority of the churning as well as grinding effects of the food mainly takes place at this part. It softens and mixes the food with gastric juices by its peristaltic movements and churning movements. And gastric juice, which is produced from the gastric glands, contain enzymes which helps the digestion of the food in the stomach. And stomach helps in the absorption of the vitamin B12 by producing the intrinsic factor of Kazal. So this is what you need to know about the functions of the stomach. And the next is histology of the stomach. As I already told you that the stomach has mucosa, submucosa, muscularis mucosa and serosa. So first is the mucous membrane. At the cardiac end, the mucous membrane contains simple columnar epithelium with small tubular glands. Next, if you see at the fundus as well as body of the stomach, the mucous membrane contains gastric glands. They are tall and simple tubular glands. So these gastric glands, of which upper 1/3 are conducting and lower 2/3 are secretory in nature. Next is the chief or zymogenic cells, oxyntic or parietal, and mucous neck cells are mainly seen in these glands. Next is the pyloric part. The mucous membranes lining the pyloric part. The mucous membrane at the pyloric part contain pyloric glands, out of which 1/3 are basal, that are secreting mucus, and the upper 2/3 are conducting in nature. And the next is submucosa of the stomach. The submucosa contains loose connective tissue with Meissner's plexus, and the next is called as the muscularis externa. At the cardiac end, it contains outer longitudinal and inner circular layer, including Auerbach plexus, or also called as Mantric plexus of nerves. And fundus as well as body of the stomach contain additional innermost oblique coats of muscle fibers. And the pyloric part mainly contains the pyloric sphincter, which is mainly made up of the thick layer of circular fibers. And next is the serosa of the stomach. It contains a single layer of squamous cells. So this is what you need to know about the histology of the stomach. And the next is the development. Stomach is developed as a fusiform dilation from the lower part of the foregut in the 4th week of the embryonic life. At first, it is placed in the median plane with a concave border in front and convex border behind with the right as well as left surfaces. Anterior border of the stomach is attached to the anterior body wall by the ventral mesogastrium. The posterior border of the stomach is suspended from the posterior body wall by the dorsal mesogastrium. And here the stomach undergoes rotation to the right side. So here, as you can see in this picture, the anterior concave border forms the lesser curvature and the posterior border forms the fundus and the greater curvature. And the right surface of the stomach becomes posterior inferior surface and the left surface forms anterosuperior surface. That is why the left vagus nerve supplies anterosuperior surface and the right vagus nerve supplies posterior-inferior surface of the stomach. Now, the ventral mesogastrium forms hepatic bud, which mainly develops into liver, coronary as well as falciform ligaments and lesser omentum. And the dorsal mesogastrium mainly forms greater omentum. These are the important high-yield points what you know about the embryology or development of the stomach. And at last, what is the clinical significance of stomach? The first condition is the congenital hypertrophic pyloric stenosis. In this condition, there is a marked thickening of the smooth muscles in the pylorus, and which is most commonly seen in the infants. In neonates with the pyloric stenosis, the elongated overgrowth pylorus is extremely hard and the pyloric canal is narrow in nature and resisting the gastric emptying. So that is the reason it causes vomiting after meals, as well as peristalsis is clearly visible in the epigastrium. Next is the peptic ulcer. It is the condition which is seen when there is erosion in the lining of the stomach or duodenum. For example, if you see gastric ulcer, which is most commonly caused by H. pylori, but it is also caused by stress, excessive secretion of the acids as well as pepsin. Most common site is along the lesser curvature near the pyloric antrum of the stomach, which is called as gastric ulcer. And gastric ulcer, which is more commonly seen in the men. And the symptoms include the epigastric pain, which is burning, cramping or aching type, abdominal pain, and more commonly the problem of indigestion will be there, nausea, vomiting, loss of appetite, loss of weight, as well as bleeding through stools are the most common features in this peptic ulcer disease. And what is the treatment? The treatment includes administration of antacids, partial gastrectomy or vagotomy. These are the clinical conditions what you need to know about stomach.